Hi everyone, welcome once again to this tutorial. I am your host Dr. Moez Kakiani, prosthodontist from Mumbai, India. Friends, in this video we will be discussing about margin architecture. Friends, before I go into the discussion of the topic, let me share with you a small little experience that I had recently. I happened to go over to a colleague's practice, and that's where I understood of a mistake that he was doing. He first prepared the tooth for the patient, he registered the impression and then sat in discussion with the patient of the different prosthetic materials that were available and what is it that he would plan for that patient. Now what went wrong in this process, friends, is what you need to do is first choose the prosthetic material that you will be giving your patient, and on the basis of that you prepare the tooth. Alright, so let's understand from this very correct chronological sequence. If I were to prepare a tooth for either a PFM based restoration or a metal free restoration, what should be the margin design? Friends, whenever you prepare a tooth for a PFM, the first thing that we need to understand is the different margins of a PFM require different architecture to be given to it. Now let's say, for example, the buccal, the mesial and the distal margin, which means the buccal and the two proximal margins in a PFM need to be what is called as a modified shoulder margin. I'm guessing a lot of you all are not aware of what modified shoulder is. Having said this, I'm sure we all know of what a shoulder margin is. A shoulder margin essentially is a 90-degree butt margin. It's made with the help of what is called as a TF burr, or TF stands for taper flat. What you see on the screen right now is a TF burr. One of the concerns, friends, in a shoulder margin is the fact that the internal line angle is extremely sharp, which means it tends to concentrate a lot of stresses. Have you ever come across a situation, friends, where a patient comes to you with a crown in the hand saying, "Doc, this crown has come out"? When you look at the tooth, you appreciate the fact that this is no longer a case of decementation, but a case of abutment tooth fracture. Now, where did the abutment tooth fracture? Exactly at the preparation margin. One of the reasons why this happens, friends, is because maybe in that situation, a shoulder margin was prepared with the help of a TF burr, it landed up concentrating a lot of stresses, and the weakest link, here the abutment margin, simply just fractured away, leaving behind a poor prognosis for that tooth. How do we avoid such a clinical situation? One such way, friends, is to move away from a shoulder margin to what is called as a modified shoulder margin. The burr that you see there, friends, is essentially a MS burr or a modified shoulder burr. As you can clearly appreciate, the tip is still flat, but the edges are rounded, which means the internal line angle is rounded, thereby no longer concentrating excessive stresses. What this does is it adds more predictability to your work. It even adds more longevity to your prosthesis because your abutment now is nice and healthy. Showing you an example of what an MS burr looks like. This is an MS burr from MIK Dental. Appreciate the fact that the tip is flat and the edges are rounded. Now, friends, what's important to understand is the MS burr is essentially used at the buccal, the mesial and the distal margin, where a porcelain is layered on top of the metal coping. However, if you look at the lingual or the palatal aspect of PFMs that come to you, the coping in itself will have what is called as a metal collar. You will realize, friends, that the lingual or the palatal margin does not have ceramic layered on it. One of the reasons why we do this is in an attempt to conserve tooth structure. This is simply because a metal margin does not require as much reduction as a margin where metal is layered with ceramic. So the lingual or the palatal margin in a PFM classically, friends, is a deep chamfer margin. This is, friends, a deep chamfer margin. What I want all of you all to appreciate here is how the tip is kind of just a half moon or a crescent shape. Now what's important to understand in this half moon or crescent shaped burr is the tip of this burr, friends, should only be sunken half depth into the tooth. Now giving you a perspective of what a deep chamfer is on the left of the screen as against a modified shoulder towards the right of the screen. What you will appreciate if you look closely at the tip is the MS is more flat, whilst the DC is more rounded. The MS is what we use on the buccal, mesial, distal of a PFM. DC, which is the deep chamfer, is what we use towards the lingual aspect. I earlier mentioned, friends, that the DC burr should only be used half depth. Why is this so critical? It is so important, friends, because if you go more than half depth, you leave what is called as a lip of enamel. The lip of enamel gets beautifully registered in your impression. It will get transferred onto the cast, but unfortunately, on a lot of these casts, that small little fragment just breaks away, which means now the margin on your die is not the same as the margin in the patient's mouth, which means a prosthesis that fits the cast perfectly, if you place it intraorally, you realize that is not seating down to the margin. This is simply because a small lip of enamel stayed back. This will happen if you use a deep chamfer burr more than half its width. So friends, this was about the PFM. What about the metal free? Now when I say metal free, it's classically either a PFZ, that's a porcelain fused to zirconia prosthesis, or an EMAX prosthesis, which is a lithium disilicate based restoration. In either of these, the preparation protocol is a lot more simpler because the margin, friends, is only and only a deep chamfer all 360 degrees of the preparation. This is because you don't have a metal coping that needs to be layered with ceramic. So the amount of preparation is less and the margin is only a deep chamfer. What this means essentially, friends, in dentistry as of today, we only and only can survive if we know how to prepare two different margins. One is a modified shoulder, one is a deep chamfer. The other margins that we may have learned during our schooling, friends, those are no longer practiced as of today because a lot of these margins were designed for gold-based restorations. And unfortunately, we clinicians do not have gold at our disposal for our patients. Friends, I hope this short little video helped you understand the concept of margin architecture and how that is dependent on the prosthesis that you choose. If you like this video, feel free to share it with your friends. Until we meet again, wishing all of you all good day. Bye-bye.